The technology should be rewarding for investors as well. If someone puts some money and then waits for 15 years, what is there for me for waiting for 15 years? It's not a charity. The investor at the end of the day, they have to make money. So my business plan should be palatable to that. They should make at least 100 times or more of their investment. So what I mean to say here is those who are aspiring to be or want to become an entrepreneur, you may have a good idea, but you should also have a practical, realistic business plan. Where do you bring money? Because once you start, you cannot leave it between, because lots of money and effort will go waste. So schizophrenia, as I said, $40 billion market. 1/3 of the patient population, they discontinue medication or do not respond to current treatment. So I thought, here is an opportunity. And then if the market is there, if the science is good, you may be able to develop a new drug in the next 15 years that can benefit millions of people. Investors will be happy. I am an inventor. I will be happy. Kind of an ecosystem. So that's what the selection, what we select a drug to develop. That's extremely important. Not only in our drug, if you are in IT or any business, you select a path. You need to visualize in mind. It may not work the way you visualize, but at least in all angle you think, get experts' help if needed, and then make a kind of path from A to Z where you have to arrive, how much time it takes, all these things. So all this worked out. Bottom line is science is good, and then market is there. The third one is I need to raise money. So I was able to, God's grace, I'm so far been successful in that. Who knows future.
Yeah. Hello, sir. Hello, sir. Good evening. A very nice presentation, first of all. After doing this presentation, one can, understand the complexity of this illness or nature of a very complex nature. So my question is that these diseases were exist, let's say 20-25 years back.
Sorry, lot of echo.
Yeah, these diseases or the illness were existed say 20-25 years back. Okay, that's my first question. And the second question is, if this exists, have you not heard about it in India?
You mean the disease?
Yeah, or the illness where exists. Have you not heard about this disease, illness in India? And the second part is, how we can, have the, early detection or let's say kind of awareness to overcome these diseases? These are two part of my questions. Thank you.
Sure. The disease, schizophrenia is not like we discovered in disease started in 25 years ago. It's there years in the, I think, mankind, that age. It's only the modern medicine we gave them schizophrenia, and then treatment started in, I believe, the first drug accidentally discovered in 1968, chlorpromazine, that's the old drug. But it's an incremental improvement built upon the existing knowledge. So what I discovered is based on the knowledge, the current knowledge, improved version of that. Maybe in the next couple of years, someone will develop what we develop. It's a continuous process. So the bottom line is, we need to develop a drug that's continuous improvement of what is there at time. So the second part, the schizophrenia existed in India. We, not only me, any entrepreneur who starts developing drug in this space or any space, generally we are updated with globally what's the status of the disease. See, I'm kind of extensively traveled various countries and had the first-hand knowledge of how the schizophrenia is treated in Russia, Ukraine, Far Eastern countries, Malaysia, Philippines, various countries I traveled. See, Well, starting the company, kind of globally, what's the status of the disease, how they are treated, all these things kind of studied, then now they started. So with other companies also started doing this business, they evaluate the process. So the last question, sorry, I did not.
Awareness and the early detection.
Early detection, as I said, it's a very grey area, and then also acceptance is also a challenge. I'm sure psychiatrists here is quite experienced in this. So mental illness is a kind of a stigma. No parents would like to accept my child as mental. As I said, it's early onset. So often they think that, again, even in the US, developed countries, this is the problem. ADHD. So when doctor prescribes a real problem, teacher will have problem in the school because other students are getting disturbed. And when doctor prescribes drug to medication, parents get agitated. Okay, this is not something where you are drugging my child. It's not a good thing. Acceptance is the first thing. Yes, my child has some problem. There are various ways to treat. One can explore, not necessarily with drug. If community environment and various other therapies here we call yoga, various other things that might help. If other things are not helping, it's better to take pharmacotherapy, drug treatment, nothing harm in that. So bottom line is acceptance. That is once a patient, if it is adult or a family accepted that yes, here is a problem, needs treatment. From there, I think the help starts from there. It's very important.
Thank you, sir.
ವಿದ್ಯಾರ್ಥಿಗಳು ಪ್ರಶ್ನೆಗಳನ್ನು ಕೇಳಬಹುದು. ಕನ್ನಡದಲ್ಲಿ ಕೂಡ ಅವಕಾಶ ಇದೆ.
Sir, good evening. How the physiotherapy will help the mental patient? For example, the blowing the water on the head, it will benefit to the mental patient. What do you feel about it?
Well, there are a lot of things that people say it would help. We call in medical treatment is a placebo effect. The placebo effect, even if a patient reaches hospital, if doctor treats them very nicely, it to a great extent they feel better. The placebo effect, what happens? It doesn't last long. So after maybe a week or two, the symptoms again. Those who are the lucky ones, surrounded by good family, if they encourage these patients, and then possibly the placebo effect may last long. We hope many patients will have that placebo effect lifelong, but in reality, that is not the case. See, placebo effect lasts very shortly. Reality comes into picture. They need medication.
Do you have any idea of this hydrophobia and kleptomania and lesbians? Is it relevant to the
Sorry, good one.
hydrophobia,
Yeah.
kleptomania, and this lesbian? Can we avoid all this?
So this is a
Treatment behind it?
that is slightly different. That comes under the medical term, if I'm correct. It's a general anxiety, we call it. That often maybe drug may not be the only therapy for that. That is a psychotherapy, sometimes it helps. Experience a psychiatrist, psychotherapy along with the drug combination might help. So,
Sir, good afternoon. This is more of a curiosity than a faith. I'm Dr. Bhavesh.
what am I slightly far?
I'm Dr. Bhavesh. Actually, 234 is really a good number, sir. Study. How long was the, how was the duration of the study? What was the duration of the studies? Total duration?
So if I remember, if I get correctly, you said that how long the trial is conducted?
How long trial was conducted?
I'm getting a lot of it.
What is the duration of the
Trial, okay.
Trial, total duration of the trial.
So total duration of trial, as I said, there are 3 stages of development in psychiatry. So the global requirement is phase 1 is typically starts with 1 day to 10 days, and then you increase the dose, escalation of dose as high as possible. The goal is patient should get really some cardiac side effects. We keep the emergency side back. That's the way we dose it as high as possible. And then if patient gets really side effect, mainly cardiac side effect, emergency will immediately kick in, and then we stop it. So the whole purpose here is when a drug comes to market, accidentally somebody consumes drug, the doctor should know how high is the high for patient. That's the phase 1 study. Then phase 2 study is really proof of concept. So we develop new drug. It really works in patients. So that study is around 4 weeks of treatment in acutely ill patient. Once we see the efficacy and the acceptable side effect, typically it's around 200 patients. Then it comes to phase 3 study. Phase 3 studies are 3 studies we have to do in phase 3. 2 for efficacy study. We call them as pivotal study. So, its mainly primary goal is to efficacy. In acutely ill patient, one month treatment to 6 months, 4 weeks to 6 weeks treatment. What's the improvement? Improvement should be such that it should be better than placebo, statistically significant improvement. Generally, if it is improvement is less than 20%, you don't get statistical significance. Trial will fail. So basically, phase 3 studies are around 6 weeks. And even though the study is 6 weeks, it takes around 2 years to complete. 2 years to complete global study. So this is the way the drugs are developing. Our study is in the phase 3 study last stage. We are wrapping up this study sometime in next year, August. It is in the treatment of 1,500 patients. Globally, 38 to 40 sites are currently enrolling patients. 12 sites in the US, 8 in Europe, I think around 22 in US. So it takes altogether around 7 to 8 years of clinical trials altogether, around 6 to 7 years of non-clinical, from discovery, conceptualization to clinic, altogether from a concept to or the bench to bed, it takes around 15 years.
Was it a multi-centric study?
Sorry?
Multi-centric study.
Is it a multi-centric study?
Yes, it is a multi-center trial. In fact, in India there are a lot of apprehension for the clinical trial. As I mentioned at the beginning, that the 144 people, the government should encourage clinical trials. More and more clinical trials comes in. Again, it generates a lot of jobs. Hundreds of millions of jobs will be generated. And then at the same time, younger generation will be trained how to do the trial. Currently, US and then Europe are leaders in this clinical trial. Of course, in India, trials are conducted, but only upon approval in the US, extended to India. That's the way they're currently being treated.
Can we, depending on your experience, can we generalize it to Indian population? If so, how best can we generalize it to Indian population? Asian.
So, Indian population, of course, that's the whole purpose of coming to India as well. So, we are a global company, we develop drugs for global market. So, genetically what happens, Indians are different than Americans. So, by doing the trial in India, it is extremely important for Indian population. When they take drugs, many drugs currently in the market, it is not tested in Indians. We don't have data in Indians. This is very dangerous sometimes. So, but in US, that is not allowed. Unless it is an extremely rare disease, US government will not allow, unless the trial is in US significant numbers, they would not approve drugs to US market. it's extremely important Indian people to come forward for the trial and then generate data. And then only once you have the data, the physician can understand to a great extent how this drug works in patient population. So that's extremely important. I'll give you one example. Household drug. You all know the Lipitor. Cholesterol lowering drug. Every house has a drug. Lipitor is a brand name, American name. Here it is called atorvastatin, with a different Indian name. I'm sure every house has Lipitor. If you look at Lipitor,